Earl Warren said, "Everything I ever did in life that was worthwhile, I caught hell for." That's me. Unless you're a cat, you've got to think out of the box.
Dr. Loretta Ford's knack for thinking outside the box transformed the nursing profession, the delivery of healthcare, and consequently benefited generations of patients worldwide. Speaking with a group of friends, admirers, and former colleagues at the University of Rochester School of Nursing, the visionary pioneer reflected on the challenges and opportunities she faced in developing the nurse practitioner role 50 years ago.
There was a shortage of physicians. The shortage was a good thing because it gave us the opportunity to try something new. We decided that this was a nursing model, and we were going to promote that as stuff.
Dr. Ford knew nurses could do much better at serving patients and the whole healthcare system if they had advanced practice education.
In that next level of care, you would have individuals that would assess, diagnose, treat, and manage patients in a variety of different settings and a variety of different issues.
With this new model for advanced practice nurses set in motion, Dr. Ford was asked to lead the establishment of the UR School of Nursing.
With her came her vision and her plans for what nursing could be, recognizing what it was and recognizing the strengths within each one of us to move the profession in a whole different direction. And so it began with the pediatric nurse practitioners, and then it has expanded to acute care nurse practitioners, family nurse practitioners, psychiatric mental health nurse practitioners, adult geriatric nurse practitioners, neonatal nurse practitioners. They are incorporated within a team of individuals, be it physicians or social workers, nutritionists.
Today, her vision is reality. Nurse practitioners have become embedded in every part of healthcare. There are more than 205,000 nurse practitioners in the U.S. and more than 400 employed at Strong Memorial Hospital.
Having nurse practitioners has provided a great resource for the community. That resource is really established through access to care, and as more nurse practitioners are incorporated into the variety of practices, it does afford our patients to be seen quicker and more efficiently by a healthcare provider.
Cancer patients can involve 5 to 10 extra providers taking care of them. And with that comes clinic visits, appointments, lab draws, imaging. It is so important for our nurse practitioners when we're seeing the patients and providing care and doing our physical assessments that we do, also always thinking about the mental health of the well-being for the patients and the families. It's a really intimate relationship and it's trust building. Listening to Dr. Ford yesterday, you felt such a pride with that, to understand that you're a part of her journey and her mission and what she created here.
Dr. Ford's original vision for nurse practitioners has not wavered in half a century. But the extent in which NPs do these things has and will continue to evolve.
We have opportunities for nurses to be innovative, to be inquiring, asking some really tough questions. Do we need to do this? Does it really help patients?
The University of Rochester School of Nursing has always had its finger on the pulse of what was currently happening as well as what is in the future. And not only seeing what the future could be, but actually designing what that future needed to be. We are continuing as generations of innovators because we've had that foundation modeled for us by Dr. Ford.